No. Hi, Wendy. I understand that you're a neuropsychologist and that you do neuropsychiatric
Evaluations.
evaluations for kids that have been treated with brain cancer. So, can you tell me a little bit about the diagnostics you use to test the children, and also how do you measure each cognitive domain with these
Yes.
tests?
Um, so we use what we call a battery of standardized tests. And those include things such as the Wechsler intelligence scales. We also, and those tests tend to measure sort of global IQ, which includes like their verbal comprehension, their perceptual reasoning, which is sort of making sense of abstract information and problem solving with abstract information. Um, the Wechsler tests also look at working memory, which is your ability to hold information while you're sort of responding or following rules or reacting, and then the speed of the processing. So those sort of things might make up what we call IQ. And so that's sort of a global measure. And then we target more specific aspects of cognitive functioning, so like memory. We'll look at executive functioning. We'll look at attention, visual spatial, and social emotional.
And then how about achievement tests in terms of reading,
Right.
writing, math?
So we include achievement tests and a brief achievement test. So we'll look at word reading, spelling, and like math problem solving, math fluency. And so we'll include that in the battery to see if there's any discrepancy between their IQ and other aspects of cognitive functioning and how they're performing in terms of school academics.
Okay. And what makes a child eligible for an IEP? I
Mm-hmm.
understand that you evaluate them prior to having
Mm-hmm.
an
Yeah,
IEP.
sometimes they might already have an
Uh-huh.
IEP. You know, it might depend on sort of where they are, but sometimes they might already have one and they just need sort of follow up evaluation. For my department, we just do testing every 2 years.
Okay.
So what makes them eligible for an IEP is how they sort of perform on some of these tests. If there is a huge discrepancy between their achievement testing and some of their cognitive testing, then we would say that this looks something like a learning disorder,
Hmm.
and that we have specific types of learning disorders. There's, a math the learning disorder, a written expression
Hmm.
learning disorder, receptive language learning disorder.
Hmm.
Um, but if they're looking okay in those aspects, then and they're just sort of struggling with maybe one aspect or a few aspects of cognitive functioning, then they would qualify under like other medical or other health condition, other medical condition,
Hmm.
which is one of the categories of the IEPs, and then they would get services for that.
Do you work with the SS team in
Mm-hmm.
designing or
Mm-hmm.
planning a curriculum
Yes.
for the student?
So what I would do is I would send recommendations. That is something that I have the option of doing, but I'm
Hmm.
fairly new at my position, so I
Hmm.
haven't started doing it yet.
Hmm.
But in the future, I'd like to sort of be part of the study team and the IEP team, and sort of
Hmm.
we all come together and we can talk in person about sort of the accommodations that they might need to help
Hmm.
them succeed and be successful in school.
So, are you familiar with any of the accommodations that they're using for children
Mm-hmm.
in terms of academic
Mm-hmm.
learning?
Yeah. So some accommodations include things like extra time on tests,
Hmm.
um, uh, lower homework load. Um, what else? Maybe sitting in a different room during test, allowing them to audio tape or even videotape classes or lectures, having people help them take notes, having teachers provide notes or a
Hmm.
summary or an outline of their lecture so they could follow along. Having sort of a one-on-one person sort of help them understand what they're listening to or learning or reading. There's like a lot of different things that we could recommend, um, and it's also up to sort of the resources the school has. Sometimes they just don't have the resources, but they do try their best.
Okay. Also, how about behavioral interventions? Do you know
Mm-hmm.
any of the behavioral interventions that
Yeah.
they might use, or
Yeah.
what kind of behavior
Mm-hmm.
issues might arise from having
Mm-hmm. Yeah.
this?
So some kids, it's common for kids to endorse symptoms that are associated with depression
Hmm.
and anxiety, low self-esteem. And so, in addition to maybe having, a non-school counselor on site, I would also recommend having things like maybe an outside therapist. Recommend having like a behavioral modification program to help the kids, or plan to help the kids improve maybe their self-concept, their self-esteem. Um, it's common for some reason, I'm not sure why, but for kids to feel like they're not normal, they're not good enough, and that really sort of dampens their sort of motivation to try to do well in school and stuff like that. And so, helping kids sort of deconstruct these sort of automatic thoughts and helping them come up with more accurate appraisals about themselves.
And I just have one last question. This subject is so fascinating to me, and I think other people would want to know. Um, for in terms of brain cancer itself and their survivors, I've always thought that once you survive brain cancer, I never thought about the after effect. So, um, tell me a little bit more about the cancer itself, where it is in the brain, how it affects the brain, and the therapies actually that actually hinder the brain development.
Right. So, the science has gotten really good at stopping, sometimes even curing the cancer, but it's not very good at the after, like you're saying. So there's, a few different factors to consider. One is the kind of tumor that the child might have. So it might be a solid tumor, those are sort of sometimes your best bet, depending again where they're in the brain, because they can sort of nicely take those out, and sometimes you don't even need chemo radiation. Some tumors are a little more, for lack of a better word, squishy, and they might sort of infiltrate other areas, and so they're not easy to sort of take all out. Other tumors might be in parts of the brain, like the brain stem, that are vital for like just regular functioning, like breathing and regulating your heartbeat. And so those rarely get resected. They more get treated with chemo or radiation. So it depends on where in the brain the tumor is, what kind of tumor it is. And then chemo in itself has cognitive consequences that can affect the cognitive development of children. And if there's a recurrence, sometimes they include other treatments or agents such as radiation, which then further impacts the cognitive development of the child. So there's no really one simple answer for that. Again, then it depends on the other end, the family. How helpful are they? What their resources are financially? What kind of school district are the kids in for them to get resources from their school district? So all these things sort of play, these factors or play a role in how successful a child might be.
Thank you so much, Wendy.
You're welcome.